Debunking, your podcast show. My name is Kori Lehr. I am your host and the Director of Communications for the Senior Companies. As always, we are back with another special guest. Today, I have Kelly from Hospice of Michigan. Welcome to the show.
Hi, thank you. Thank you for having me.
I am so glad that you are here because you are here to talk about a subject that a lot of people don't like to talk about. And that's for a number of reasons. And so I'm really glad you're here because it is so important that people are aware and have some education so that they can feel confident in making some decisions for their lives or helping others make decisions for theirs.
Yep, absolutely.
So Kelly is the statewide director of marketing, which includes Hospice of Michigan, but there are a couple of affiliates in that program. And so we're going to let her talk a little bit about that. But what we're really here to talk about is hospice care. And so what steps do we have after we've maybe gone through some treatments or we've got some news, we're at later stages of an illness perhaps, what beyond those sorts of treatment options do we have, or if we've exhausted some other sort of comfort care. And so I'm really glad that you're here to talk about it because I do feel like it is a taboo sort of subject. And I'd like to, to understand maybe your insight on why you feel that is.
Sure, absolutely. So do you want to start there?
Yeah, please.
Okay, so part of the reason why I think hospice is a taboo topic is because, obviously nobody wants to talk about death and dying until they're like faced with it, right?
Yeah.
And so part of our mission is to help people to be more informed up front before they get into crisis mode so that they can make better decisions. That's the ultimate goal. So we want people to know what services are out there. We want them to know what the services actually are so that when it comes time whether it's your doctor that tells you that, you have a terminal illness or you have a life-limiting illness, and, maybe this is something that you need to start thinking about, or you yourself decide, I think maybe it's time for me to start thinking of alternative ways and not the aggressive curative treatment because
Sure.
I don't think that's, going to help. Then we want you to know what is hospice, what do the services mean, how is it going to benefit you, how is it going to benefit your family so that you can make the best decision.
I agree with you because a lot of the time it is emotionally charged. And
Yes.
so if you can be armed with that information a little sooner, then you'll be able to feel better and confident. And sometimes I think too, there is some family dynamics there. Maybe you're thinking about it and then the family's not ready for it because it just sometimes for some reason, hospice just those words hold such a weight for people.
They
from
do.
like preconceived notions or other things from years ago that they have felt. And so I think being able to stand strong in what you decide for yourself helps everybody feel comfortable.
Absolutely. And there's a lot of fear around medications and, nutrition as someone ends their life. And, there's been a lot of media coverage about this topic in past years. And so I think the unknown is scary. And, so I think it's important for people to know, like, what is this going to look like? What does hospice mean for you? What does it mean for your family? And, so many times we hear, like I say this every time I talk to somebody, so many times we hear, somebody comes onto hospice and they'll say to us, I just wish I would have called you sooner because once they really feel it and really know, then they're like, who wouldn't do this? Yeah. But until you get to that point, it's super scary and it's a big decision to make.
Absolutely it is. And I think being in charge and because some people feel like losing some independence and some of the decisions, especially medically, taking charge of that, I think really helps. Yeah. So will you explain to me then, like, what exactly is hospice? Like, what are those services that you're talking about?
Yes. Okay. So hospice in a nutshell is a Medicare benefit. So it's a healthcare benefit, Medicare, Medicaid, and it's for someone who has a life-limiting illness or terminal disease. So, whether a lot of times traditionally people think, oh, cancer. It's so much more than that, though. It's for heart disease. It's for, dementia and Alzheimer's. It's so many different things. And it's really for somebody who, when they get to a point in their disease, that they decide that they're going to go down a palliative or comfort treatment plan versus a curative or an aggressive treatment plan. And so it's really about making the choice to say, all right, we're going to change lanes here. I like to talk about changing lanes. So you're driving down the road of aggressive treatment, you're curing yourself, you're working towards that goal. But then there comes a point, whether it's you personally saying, I think I'm kind of done.
I'm tired.
Or your doctor, somebody says, I think you could really benefit from what hospice could offer. Then you change lanes. Then you go to the next road, and then you start going down this comfort path. And it really is about a team of people that are coming together to provide education, obviously care, medical care, emotional, spiritual support and care to you and to your family unit. So whether that is your loved ones, your family members in your home, whether it is a nursing home staff that provides care in addition to what the hospice team would be providing, it's about education and support for everybody involved. So it includes a hospice physician, a nurse, social worker aide, volunteers, and in some areas we'll do music therapy, pet therapy, massage. So really good wraparound service.
I love that you talked about the last three specifically, because I think people just don't understand how much that can benefit. So like, and I want to bring up, like you mentioned dementia. People they think like memory care typically with that, but having someone around to not, even if it's a volunteer, because you guys do bring in volunteers, like having that person be able to sit with the patient or the client and just be there sometimes is a relief for the family while they go take a shower. Or they can play the music, like what kind of music did your dad like, or what kind of music do you like, and it just takes them to a different mental space, especially pets. I mean,
oh, absolutely. And so dementia specifically, they say music is one of the the
like
piece
muscle memory.
It is it's something that they don't forget. And so our music therapists are actually a part of the care plan, and they'll work with the family and with our nurse on, okay, what are the songs that are going to bring up, certain kind of memories. And you'll have a patient who is maybe bedbound, they're not talking, and they're not engaging with you very much, but you play their favorite song, and then it's like instant. They engage, they wake up, and they start to sing. And it's just such a gift for families to be able to see that. We'll record it sometimes. It's really a precious moment to be able to see that go on.
Absolutely it is.
And so in hospice, we really, obviously the medical management of care is kind of the main
biggest piece.
The piece, right? Where, we're looking at medications. We're wanting to ease pain and symptoms. So we are the experts in pain. So we want to make sure nobody's, in pain as they're going through their disease progression. The other side of that, though, is the emotional and spiritual support. Yeah. So if they're having emotional or spiritual pain or concerns or fears or thoughts, that's the other members of our interdisciplinary team that really provide that support and help. And it's a really beautiful thing where, our staff will come in multiple times throughout the week, and then a care plan based on that individual is kind of created and then carried out. The other part I want to make sure I mention too is any medications or durable medical equipment that are related to why the person is on hospice is also covered, which is a huge benefit to some people.
Absolutely huge.
We're talking hospital beds, wheelchairs potentially, commodes, things that will really help quality of life in someone's home and their day-to-day, things that they need to do.
I like that you mentioned that, because while Medicare does cover a hospital bed, like the things that need to be documented and the diseases that allow Medicare to pay for that are very strict. You need a lot of documentation. And so with hospice, you can sort of break down some of those barriers. Like Medicaid would never pay for a commode normally, but with hospice, with that benefit, you have access to get help to get those things covered. I think that's really big, because those are some of the things that really add up. Absolutely.
And it's something that really gives patients a lot of ease in their day-to-day, as they're just trying to, get through the day. So that's what it's about. It's about comfort. It's about quality. It's about maintaining someone's highest level of dignity all the way through.
And I want to really talk about too, like breaking down the barrier that people always think like you need to be actively dying, like on your deathbed to have hospice. And that's not true either, because you did mention it too. Like people will say, like, I wish I would have called sooner. And that is because had they had some of these things, I don't know, 5 months earlier, being able to have that mobility and keep that up a little bit while you're still feeling okay makes it easier.
Absolutely. So I like to talk about how the national average length of stay for a patient on hospice is just around 20 days. And so when you look at hospice as a benefit, the benefit is it's 6 months. And so, and sometimes it's longer than 6 months, depending on, you know, how the patient is doing, and if they're still eligible for hospice. But 20 days is not enough time to really wrap your arms around somebody and show them the care that they deserve. And so that's why we, from our marketing side of things, part of our job is to really get out there and educate the people who are having conversations with people who need hospice. So physicians, social workers, case managers, hospitals, about just when is it the right time, what to look for, so that people can really get the whole benefit. And then we have all of our grief support that comes in afterwards. So, you know,
no one talks about that.
Right. So there is 13 months of grief support that happens for a family once a patient passes away. And so it's not like, okay, you know, the patient's on hospice, we're giving all this resource and care and education and support, and then the patient passes, and then we just say, see ya. So we like to keep connected to them, making sure that they're grieving appropriately. Everybody's on their own journey for that as well. And so the timeline is not anything that's defined. And so our grief counselors are really there to help, you know, make sure that our families are grieving appropriately and they're going down their path. And everybody wants to know why 13 months. Do you have a guess on why 13 months?
Oh, I don't know. That's a really good question. I'm not sure.
It's to help. Well, we'd like it to be a year to help kind of get through all the holidays and anniversaries and
everything,
birthdays.
all the firsts without. Oh, that's the stuff that really makes you depressed. Oh, this is the first one without. No.
But the 13 months is, we want to make sure we help get them through the anniversary of their loved one's death.
Those are the tough days. Those are the days that make you feel sad.
Yeah.
And I think, although depending on like how long that person has had services, like the people who are caring for you or your loved one, like you do make a connection and they do really truly care, because they're dealing with lots of things. They're getting to see all of your family and how everybody interacts, and you're in the middle of it, you know, doing your best to take care of that person, and you are invested.
Oh yeah. I mean, it's such a sacred time of someone's life, and to be welcome into a home and into an environment and situation where, you know, it's personal. It's very, very personal, and it's different for everyone. And so, you know, we really pride ourselves on meeting the patient and family where they're at. And so what their goals are become our goals, and we work right alongside them, because it's not about us.
Right.
It's about them.
Right. And that's what makes people feel comfortable once they do make that decision for hospice. I think then they'll realize like the care plan isn't what you guys necessarily want. It's what their goals are, and how the entire team is going to meet those goals.
That's right.
That's the biggest thing. Yeah. So I know you mentioned palliative too. So can you just briefly, really quickly tell me, like, what's the difference between hospice and palliative care?
Yep. So we started our palliative program roughly about 15 years ago. And, you know, our palliative program is really meant to be kind of for patients who are about 2 years out from end of life. Okay. And so it's a longer timeline. It's really about that patient maybe who is showing symptoms. Maybe they have something going on, but they're still seeking aggressive treatment. So you have that, you know, patient on dialysis, and they're continuing their dialysis, but they're having a lot of nausea and weakness or something.
It just gets hard to get around. So
Absolutely.
Fatiguing.
Absolutely. And so our palliative service was really put in place to help still be able to provide support and care for a patient in that space while they figure out what's next. We do a lot of advanced care planning conversations, goals of care. You know, it's interesting. I'll, you know, take a chapter out of my medical director's book. You know, he talks a lot about how when we meet with patients and families, there's a lot of education that has to be done on what their prognosis is. That patients don't typically seem to have a deep understanding of like what's going on, big picture with themselves. And so it's helpful, and it's all nurse practitioner based with Hospice of Michigan. So one thing to note too, not all palliative services are the same. And so what Hospice of Michigan provides as a palliative service might not be the same as another palliative. So it's important to ask the questions. But for us, we have a nurse practitioner that comes out, and they'll have a lot of those conversations about, okay, do you have an understanding of what's going on? Tell me what you know so far. And then, all sorts, goes in all different directions from there. Yeah. So it's really nurse practitioner based. We don't have social work. It's not that wraparound service that you would get from hospice.
Right.
It's not the 24-hour, we can come to you anytime. It's more of like a specialist, the way you would go see your cardiologist or your podiatrist. So we like to talk about, a lot of times we like to talk about what palliative is not, so you can get a better picture of the differences between the two.
So with palliative care, then, are they able to have any of the therapies that you mentioned? They
can have all of them.
Okay.
Yep. So, if you're, if you're in skilled home care, that's one of the beautiful partnerships that we have in palliative. We can work right alongside skilled home care. So you have therapy coming in, you're trying to get stronger. Yeah. Palliative can come in and help you with your pain or whatever it is that's going on. So yes, palliative is your, it's kind of your resource when you are still seeking aggressive treatments. You're not ready to say yes to hospice yet, but you kind of know you're going down that road. And then, the nurse practitioner does a really nice job too of talking to the patient about, okay, when do you feel like it's the right time? Like, what are the things that we need to,
what are some signs?
Yeah.
That's really interesting. I think that's important because I think the more resources someone has, again, it just goes back to like making those decisions, making them easier.
Yeah.
And being informed.
Being informed is the biggest thing. We want people to know what is available to them because then they're going to make the best choice.
Because I feel like some people, they're just really missing out on some of the support that can be provided. Yeah. So you mentioned how some of the signs that you might be looking for, like who determines, like, is that something I can ask my doctor and say, hey, listen, I'm a little tired. Can I have hospice? Or is that a doctor determined thing? Or how do those conversations begin? Like, when is it the time?
Yeah. So first off, anybody can make a referral to hospice. Okay. So you could call for yourself. You could call for your mother. You don't have to wait for a doctor. Certainly you can talk with your doctor about it. A lot of people think they have to wait for their doctor to bring it up. Or they have to wait for their doctor to say there's nothing more. So it is an individual choice. Anybody can say, I think I'm ready for it at this time. Now, showing eligibility is kind of the next piece of that. Okay. So we would then, say you were to call Hospice of Michigan, say you wanted to call for yourself. And so you would call us and you'd say, hi, Kelly, I'm kind of interested in learning more about hospice. So we would ask you a series of questions. We'd ask you about your doctor. Are you okay if we reach out to your doctor to get some clinical information, some history about what's been going on? Because not anybody can go on to hospice. You have to qualify. There's eligibility. And so we have to be able to look at that and determine if you would be eligible or not. So we would work with your doctor on that. And then we have our own doctors that would, look at all the information, and then we would determine if you would be ready for hospice.
And I think it's important that people know, like, they need to determine that eligibility so that it is a covered benefit.
That's right.
It's not because they want to be nosy. They want to make sure that you can get what you need through the insurance benefit that is afforded to you.
That's right. Yeah. And hospice is paid for through Medicare, Medicaid, and private insurances. So it is not a cost to family or the patient. And so, that's the other thing. We can't just have everybody on hospice. That just wouldn't be feasible. So it's really about making sure that, we're looking at the benefit appropriately. We are, determining eligibility. And then as the patient is on hospice, we continue to look at eligibility. That's why sometimes you hear about patients graduating from hospice because maybe they're not eligible anymore.
We made some improvements.
Right.
With the care that they're receiving on hospice.
Right.
It's crazy.
Imagine that. So that does happen though. And then we really just work with the families on, here are the things to look for, because if and when decline happens again, we're right back here with you.
So if they were graduating, would that be like an opportunity to then go on to palliative?
Potentially.
See, I love that. So it's not like you're like, oh, you're done again. All your resources are gone.
Yep.
Just because you've graduated doesn't mean that you still don't need support in some capacity. So if I did call and I said, oh, call my doctor, here's the information. How long does it take for you to be at my house then?
We can have somebody come out the same day and meet with you and answer questions and help you to really understand what hospice is. Depending on how quickly we can get a hold of the doctor, we can do it same day. So it just really is dependent on what is the situation and how quickly do we want to move on this? You know, some people have a daughter flying in from Denver next week. And so we have to, you know, we accommodate that. So it's really just about what the situation is.
And I think that, again, goes to show, like, we're here, we're ready, but also on your timeline.
That's right.
On your timeline. About you.
Because it is about you. This is your journey. And so we're here to make sure that your journey goes as you want it to go.
So what type of questions do you recommend that people ask potential hospice providers?
Well, like when they're shopping hospice. So I definitely recommend that you shop hospice. You know, even though
interesting term to shop hospice.
Well, it's the way that you would, you know, it's like the way you would pick anything.
Getting some bids for your carpet or whatever.
Well, but I think it's important because while hospice is, you know, we all provide kind of the same service. We all have a nurse, we have, you know, social work. It's the way in which you do it. So asking about caseloads.
Okay.
How many other patients will my nurse have? Will I have one nurse? Like a sort of a dedicated assigned nurse, or will I have different nurses? What does it look like on the weekends and at night? Is it the nurse that comes and sees me during the day? Does she have to come at night too and on the weekends, or is it a different team? One of the things with Hospice of Michigan that I think is so cool that actually came out of the pandemic was a virtual team. And so we have tablets that we give out to all of our patients in their homes, and they're able to anytime live chat and connect with our virtual team. Maybe they have a question about a medication. Maybe they have a question about when is my nurse coming again? They can just, the family, you know, the 15-year-old who can like do it faster than anybody can get on, and they can like, you know, ask a question and connect. That's in addition to the care team that comes to the home. So cool stuff that goes on, but things like that, you know, social work, hospice aid, what are the other services that hospice will provide? So you kind of get a really good understanding of what is the care going to look like? And then, you know, what happens if we go out to the hospital, things like that. What's the, you know,
what's the protocol?
What's protocol? Do we call you? Who do we call? Just so that everyone has a very clear understanding of what the plan is. So when patients and families start to ask questions like that, you start to see the differences a little bit on how hospices operate.
Yeah. And while there are like regulations that Medicare and Medicaid have put in place, there is some leniency in how certain places are run. And I do think it's important to call around and ask some questions, because you want to feel comfortable. I mean, obviously, if you get on the phone with somebody and they don't have a lot of the answers that you're looking for, on to the next.
And it's about finding your fit.
Yeah.
You know, it really is. Who are you most comfortable with? And it's your right. It's your right to pick your own hospice. It's your right to change hospices. So say you choose one, and then they come out and you're like, I'm feeling a little uneasy about it for whatever reason. You can switch hospice too. So again, you are in total control of what's going on.
If you did choose to do that, which I'm not sure how often that would happen, but like, is there a waiting period? Do they have to wait a certain amount of time before they would make a call and say, I want to start?
No. I mean, I don't think it could happen same day, like from a billing perspective, but there's no like 6-month waiting period or anything like that.
That's really nice too, because that makes people feel comfortable also. And then people can go, I like that you mentioned that you can graduate. Sometimes you can go on and off if for some reason you're like, oh, I thought it's what I wanted, and now I'm not so
Changed
sure.
my
I'm
mind.
a little nervous. It's not like a contract you're locked into.
Nope, not a It's actually easier to sign off of hospice than it is to sign onto hospice.
Well, so, and I like to, you really talked about having it be personalized. So what someone's experience is on hospice or something that they remember isn't necessarily going to be yours and your family's.
Right.
Which I think is really super important. So Hospice of Michigan too, I just want to make note, is Michigan's pioneer hospice. They're one of, it truly is, it truly is. And so they're actually one of the nation's leading not-for-profit hospices, which I think is huge, because I think those from behind the scenes know, while hospice pays for a lot of things throughout that care, if you're only averaging 21 days, there's some cost there. So I think that a not-for-profit, I think, puts patients and their families even more first.
Yeah, I would agree with that. And I mean, I've worked
I can say that because I don't work for Hospice of Michigan.
well, but coming from, so I've worked in a not-for-profit for 16 years. So I've been with this organization for 16 years. And you are right. You know, the way that we say yes or no to different things, it really we have the patient and family first in our mind. And, you know, the other thing too that a lot of people don't know is a lot of the parts of hospice are not reimbursable for us. And so like those 13 months of grief support, the music therapy, our palliative program, we don't get any money for that. We all are funded through philanthropy and our development team.
Yeah.
So we really rely on the community to support us and to, come to our events and to, if they feel, strongly to make a donation or something like that, because those are the things that really push the quality and our commitment to the community kind of higher.
Yeah, absolutely. Those are the things that can make the difference in something that someone needs, or getting that extra visit from something or whatever it may be. I think that's pretty amazing. So specifically with Hospice of Michigan, you guys are, we mentioned earlier in the beginning of the show that you guys are like affiliates of North Star Care Community. Do you just want to briefly touch on that?
Yes, absolutely. So North Star Care Community is our umbrella name. And so we have Hospice of Michigan and our Errer Hospice brand under those names. And this is really, this North Star Care Community name was really born out of a vision that our CEO had about raising up other not-for-profits. And so for those of you who live in Michigan and are familiar with the Detroit area, Errer Hospice and Hospice of Michigan were always competitors. And so why would we compete, and why wouldn't we come together and just be able to care for that many more patients together? And so on the backside of things that patients and families wouldn't necessarily ever see, we affiliate and we come together. So things like payroll and human resources and all of our processes that we develop out externally in the community, you wouldn't know. You would think Hospice of Michigan, Errer Hospice, but in the background, we are sharing resources, we're sharing information so that, everybody is kind of rising together. So
I love that, because that's all of your interdisciplinary team collaborating. What someone does really well, we might need help on. And so combining together just is the best for everyone. So I think that's really cool. If you could think back through the different client or patient stories that you have, is there one that sort of sticks in your mind? I know you mentioned you've been doing this for 16 years, so
so I don't see patients all that often. I actually went out just last Friday to meet with a family about what is hospice, and it gives me a lot of energy when I'm able to do that. But I think back to when I first started 16 years ago, I can still see, I don't know where the house is. I remember the city that was in, but I can still see the patient, like her face. I remember the house, like the inside of the house. I remember the family. And it's like, that is when I first really saw what hospice can do for somebody. It was a cancer patient. She was young and she was really scared. And I was there with our social worker and I was there with our nurse, and that just, it imprinted on me. And for whatever reason, I mean, I know the reason, but it just will always stay with me because it's just like, yes, I was meant to do this. And I saw right then and there what hospice could do for them.
I think that's really important. And again, I can't express to our audience enough, like, if you are in and actively caring for that person, like, you do care about them. I mean, you're like, how could you care about somebody in 10 days? Like, when you see what their goals are, or you hear about the impactful stories that they made on their family or their friends and everything, like, it absolutely has an impact on you. And there always are, like, while you care about every client that you've seen, like, sometimes people just really stick with you and they change your life. And you're like, for sure, I'm here to help, change you and make your life better. But the impact on you is something you don't always necessarily expect sometimes.
Oh, no, I did not expect it. And that's why it's so, like, that's why I feel so
profound.
It is. Yeah. And I feel so strongly about making sure people know, just find out what it's about, because then you'll have a better idea.
And you don't have to have everything. Like, if you don't want 5 therapies and you don't want music therapy and all things, then you don't have to have that. You can pick and choose which things that you want and absolutely tailor it to yourself. So if you don't want to feel like, you've had 3 people coming in and out of the house today, then don't.
That's right.
Don't. Or if you change your mind and the next time you do, like, they'll work it out so that, and create a schedule so that you can have what you need and sort of when you need it.
And if you don't want to get up until 10 a.m. and have ice cream for breakfast, that's great. We're not going to sit here and say, where's your eggs and you better have your grapefruit. And, it's about quality.
Yeah.
It's about quality.
I think, you definitely need some more yes days.
That's right. I love that. Yes days.
Yeah, everybody
I want a
needs
yes
one
day.
sometime. Well, we got some ice cream here. We can go eat some. We can start it that way if you'd like. So obviously, Hospice of Michigan is an amazing company. They're changing people's lives every single day. They have a caring staff. I encourage you, even if you're not all the way there or you have someone who's at the beginning stages of something, just call and get some answers. Ask the questions. Doesn't have to be them, but obviously that is like Kelly's job is to provide that education. And I don't think she's tired of it yet. She's still got that twinkle in her eye. I can see it from here. So
yeah, thank you.
It's really important that you feel comfortable. Get those questions answered. If they would like to reach out to you, they can call Hospice of Michigan at 888-247-5701, or they can visit online at hom.org. I love that it's simple, hom.org. Yep. There's lots of resources on there. It goes through all of the services offered, how to, the whys. There's some blogs and different things on there and different articles that you can read.
Yep. You've been on it, clearly.
Yeah, I have once or twice, but I think I love all the resources on there. So even if you're not to the point where you're like, I'm not ready to actually talk to someone, I just want to read up on it. Like that's a great place to start.
Yep, that's right. Yes, and even if you do call, it's not like, oh, you're in our system now. Yeah. It's just about, you can get some information. You can say, I don't want to make a referral. I'm not ready for anybody to call me back. I'm just looking to get some information, and that's okay. We are not here to force you into anything. It's just about giving you the info, and then it's on your timeline.
Yeah, I love that. Because you're right. Again, all the emotionally charged situations, like everybody needs time to process, and definitely I can tell from you guys, respect that and allow people to have that space to process those things. Yep. Is there anything else that you want to share with our audience?
I don't think so. Thank you so much for having me.
Welcome.
This was so fun.
Yeah, it's my pleasure. I mean, it's a tough topic, but I think a lot of the topics that are important in life are, and we've had like estate planning. No one wants to talk about that either and again, with some of those things like life insurance and long-term care insurance and all those things, like sometimes just ripping the Band-Aid off, having those conversations with your family. Because even in my life, I remember my mom going, oh, this is what this is. I'm like, la, la, right. I don't want to hear about it. But the more you talk about it, the easier it gets. And the more you personally have the time to think about what it is that you want.
That's right. And then afterwards you feel better.
You do.
You feel like you're ready for whatever.
Yeah, I agree.
It's good.
I agree. So just talk about it. Get some of those things in place so that if something does happen, whether it's an accident or something that leads you down that hospice road, like your family knows what you want, you know what you want, and then everybody can just sort of deal with that situation a little more easily because those questions aren't there. That's where the panic and all of those different things come up, is because no one knows what to do.
That's right.
So get those plans in place. We have lots of resources on the seniormovers.com for you to look at, just as well as hom.org, hospiceofmichigan.org. If you have any questions about hospice, again, you can reach Kelly at 888-247-5701, or you can reach me at kl@theseniormovers.com or at 586-204-8500. Thank you again. I appreciate it. Such good information.
Thank you for having me.
Yeah, we'll see you next time on the Senior Podcast Show.